Okay, I'm Amy McTire. I'm going to be showing you how to do an IV piggyback for antibiotic. First of all, we do hand hygiene before going into the room. I'd go into the room, introduce myself to the patient, verify his name and date of birth. Got Mr. Shepherd here, 72-year-old male. So I'd ask him his name and date of birth, make sure that that is who it is. I'd also ask him if he was allergic to any medications to make sure that he's not allergic to the antibiotic I'm about to give to him. And also if he's having any pain or anything today. I always like to ask that for anything I do because you never know. So he's going to be getting Rocephin today, 1 gram of it. We've already started his IV solution. He's got the main one, which would be the D5.5 normal saline. So I've already got that going and infusing in him. So first thing I would do is check his IV site, make sure there's no redness, edema, no pain, no nothing to that site, and that it's flushing good. So I take and do a normal saline flush, make sure that IV site is good and patent and so can take it. Then I've already pulled all the medication for him. I've already verified that he's not allergic to it. So I do hand hygiene again, put on some gloves. I take this IV, he's getting 1 gram, so I'd mix the 1 gram with normal saline in it, shake it up to make the 1 gram. Then I would take alcohol wipe off the top of this, pull it off with a needle. Then I would change needles, well, no, excuse me, put normal saline in, air first, normal saline in, then mix it, then pull it off, change needles, pull it off with a new needle into the syringe. Then I would take that syringe, I would take another alcohol prep this side of the IV bag, take the needle, poke it in to add the antibiotic to it, agitate the bag to mix it up. Make sure there's no remnants or anything that's mixed up good in the bag. Then I would take off that and start the IV piggyback. Take that, push it in. Okay. Prime it, which it's primed. No bubbles to it. Take my hook. Of course, these bags never want to behave for you when you want them. Okay, well, we're going to hang this higher than the IV solution. So, of course, do it down to where it's hanging. The normal saline would be lower, the antibiotic would be higher. Then we take the end of the antibiotic, take the end of the normal saline, scrub, place it to it, into the hub, and then we will set this for 3 drips per minute for the patient to the solution, so it will run through the IV bag. So like I said, normal saline be lower than the antibiotic. Okay, then make sure that it's flowing good into the site. Make sure that the patient's not having reactions. Check back in about 15-30 minutes. I usually just try to check back 15 minutes with my patient, then 30. Also try to get a set of vitals after about an hour just to make sure that they don't have any temperature after the fact or any changes or anything to their vital signs, and then check on them. And then, of course, when this is done, we discontinue this off of 1, stop the run, disconnect it, and dispose of it per policy. My facility's policies, we take the whole set and put it in a sharps container, or biohazard container, sharps container. And then make sure this is running good into the site still, flush. Make sure, flush. That's always my motto. And check on the patient again, make sure he's doing good. Thank you.